Hello and a warm welcome to News Across Nigeria. I'm Olumide Macaulay. On today's program, promoting healthcare in Delta State. The solar eclipse phenomena and its implications and ramifications. And Lagos State on a cleanup exercise. Thank you so much for joining us. The United Nations Children's Fund has reiterated its commitment to continue partnering with the Delta State government in its drive to improve the health of its citizens. The head of the UNICEF office in the South-South political zone made this pledge during a visit to the state governor, Dr. Ifeanyi Okowa, at the State House in Asaba.
According to the Nigerian Demographic Health Survey in 2013, infant mortality has declined by 26% in the past 15 years to 69 per 1,000 live births, and under 5 mortality reduced by 31% over the same period to 128 to 1,000 live births. In spite of these improvements, Nigeria did not meet the Millennium Development Goals 4 and 5 to reduce child mortality and improve maternal health. These facts and others have informed the scope of UNICEF's commitment to Delta State at this meeting at the Government House in Asaba.
The maternal and newborn child health program includes programs in maternal newborn interventions, child health and immunization services, polio eradication initiative, and interventions for improvement of health-seeking behavior.
The Delta State government feels that these efforts can be achieved more effectively through the primary healthcare centers and promises to pay more attention to the ones that exist in the state.
The question is putting each and every one of them to a functional state. But there is always room for improvement, and we'll continue to do the best we can.
Improvement to make.
The Commissioner for Health points out that logistics and funding hinder the functionality of the health centers.
We don't have enough vehicles to go to the rural areas to make sure that what we put as policies are implemented, and logistics. So you find out that the programs are there, but they're not they've not been as successful as they ought to be.
Nevertheless, Mr. Ngambi is pleased to note that the programs designed by UNICEF for the state will address malnutrition, which contributes significantly to infant and child mortality.
37% of children in Nigeria are stunted. The more we are experiencing malnutrition, the more we are having our children dying before the age of 5 and many others dying before the age of 1. So that's the negative impact of malnutrition. But with regard to education, children that are malnourished will not have effective cognitive development.
The state government has also announced the contribution of 100 million naira to the UNICEF Water and Sanitation Project and promises that more funds will be released in the coming weeks.
To the northern region now, and traditional rulers from that region have resolved to lead the campaign against maternal and child mortality. The move came on the heels of the North's poor performance in the area of maternal child health, as indicators point to the high rate of maternal infant mortality amongst other regions in the country. The Sultan of Sokoto, Alhaji Sa'ad Abubakar, who chaired a forum to educate residents on the issue, says the rate of maternal mortality in the north is too high and that there should be a collective effort to reduce it.
No fewer than 100 women die daily across northern Nigeria during childbirth. That's according to the United Nations Population Fund report. This has been largely attributed to factors such as medical complications, poverty, lack of education, as well as inadequate medical facilities, among others. This troubling statistics is why these traditional rulers Professionals and others are gathered here to brainstorm and find ways of addressing the challenge. A meeting convened by the Sultan Foundation for Peace and Development in collaboration with UNFPA.
We know you have to work with the states, but in working with the state, we must go out and carry out this assignment to the best of our ability. We must build confidence in our people. Let them continue trust in us. Because the day we allow people to lose confidence in us and lose trust in us on our stand to help them, then we are finished. So we have to work on this.
The Dean, Faculty of Medicine, Kaduna State University, Dr. Joel Adeze, believes illiteracy and cultural beliefs contribute to high rates of maternal deaths. He wants traditional rulers to play a vital role in reversing this trend.
Maternal mortality has no respect for anybody. It has respect for only the person that tries to address it. Is it possible that we from the north will begin to know that it is a problem for we the northerners and begin to address it?
A message they all agree will be taken back home and ensure necessary steps are taken.
We need to talk to our governments, to ensure that our hospitals are well equipped. We need to talk to the husbands to allow their women to go for postnatal and prenatal clinics. And generally we need to provide for our children. So for us, what is needed now is to go back, with the challenge and call upon our people and educate them.
A lot of statistics about maternal mortality is worse in the north, child mortality worse in the north. And it's just time for action.
Massive sensitization and political will from government can help reduce the challenge of maternal mortality and save more lives.
Away from the health sector now, it's over a decade since the Universal Basic Education Board in Cross River State employed teachers into the state civil service, but fake certificates, demise of staff and ghost workers have made it imperative for new employment into the teaching service. Governor Ben Ayade has approved the commencement of verification exercise for new teachers, a process that will help ensure that only those with the best qualifications are employed. The aim is to rescue the educational sector from the foundation.
It's a difficult time for many states across the country as they continue to grapple with dwindling revenues, making it a huge burden to pay their workforce. That's why most civil servants being employed now face verification to ensure strict scrutiny of their credentials, where only those who are needed are taken. In Cross River State, South Nigeria, Governor Ben Ayade has given approval for the recruitment of 1,000 teachers by the State Universal Basic Education Board, SUBEB, the first time in over 10 years that fresh teachers are being employed.
Education sector in Cross River State is a priority that we must. Without education, you are nowhere. And on the basis of that, the governor is a professor, don't mind you, and this is somebody that is very passionate about education. And he appointed me. I said, look, revive SUBEB.
Applicants are drawn from the 18 local government areas of the state as Governor Ayade seeks the best hands to improve the quality of education at the basic level.
They should consider those of us who have participated for the past 2 years, and with the age, at least with a limit of age of 32 or 33, because while we were waiting for absorption, the age was not waiting, the age was counting.
I expect the government to give me a job. I want to teach because I have the zeal for it.
The fresh intakes became necessary following the discovery of fake certificates among old staff and ghost workers.
I believe that if we give teachers, those that are applying, about 1,000 employment in Cross River State, then we have done a lot. We have given food to those that have not been able to achieve that.
Education remains top priority for the River State government, which seems to be on a rescue mission of the sector. While the residents in Cross River State commend this gesture by the state government, one major concern of most academics is the success ratio of the UBE program. And for this associate professor from the University of Lagos, the challenge is the training of teachers.
Whoever conceived it is in the right direction. Will move us forward. That's what we need to do. But how did you do it? If you do things without doing it the proper way, obviously you will not get expected or required result.
Over 3,000 applicants are being subjected to aptitude tests and oral interviews to ensure only the best are taken into the teaching service of the Cross River State government.
You're watching news across Nigeria. Coming up, there's going to be a solar eclipse tomorrow, Thursday the 1st, 2016. We'll be speaking with the Professor of Astronomy and Director of the Center for Basic Space and Science, National Space Research and Development Agency, to tell us what we need to know about when a solar eclipse occurs. Please stay with us.